Hi, this is a presentation by Stephanie Strom and Tevin Early talking about the Mediterranean diet and the decreased instances of coronary artery disease for Nutrition 230.
What is the Mediterranean diet? The Mediterranean diet is a plant-based diet mostly consisting of whole grains, legumes, fruits, vegetables, seeds, nuts, herbs, spices, and olive oil. It also includes fish, seafood, dairy, and poultry in moderation. The Mediterranean diet became popular in the 1950s when it was noted that instances of heart disease were more prevalent in the United States than in Mediterranean countries. So why the Mediterranean diet? Incorporating many whole foods into your diet increases your fiber consumption as well as a diverse array of vitamins and minerals necessary for a healthy body. Also, antioxidants found in these foods have protection effects against arterial plaque buildup. One of the most notable factors of the Mediterranean diet is the inclusion of monounsaturated fats, mostly coming from olive oil. Monounsaturated fats have been shown to lower total cholesterol levels. Monounsaturated fats, which are present in foods like olive oil, can help decrease triglycerides, reduce blood clotting, and lower the risk of stroke and heart failure.
So what is coronary artery disease? It is a cardiovascular disease, and what happens is there's a buildup of plaque in the arteries that supplies oxygen-rich blood to the heart. Arterial plaque hardens and stiffens the arteries over time, and therefore reduces blood flow to the heart. Some symptoms include chest pain, shortness of breath, lightheadedness, nausea, and arm or shoulder pain, and coronary artery disease is also the #1 cause of heart attacks. In the image to the right, you can see a healthy artery versus a near complete blockage, and the yellow is the plaque buildup, and you can see that it would be very hard for a red blood cell to travel in the near complete blockage image. So what exactly is plaque? Plaque is a substance made of cholesterol, fatty substances, waste products, and fibrin, which is a clotting protein. More specifically, the cholesterol that is within plaque is LDL cholesterol, and having high LDL blood levels contributes to plaque formation. LDL cholesterol is low-density lipoprotein, and it transports cholesterol from the liver to the peripheral tissues, including the arteries. The yellowish-greenish stuff that is shown in the picture is the plaque buildup, and you can see that the red blood cells have a really hard time passing through the blood vessel.
Coronary artery disease risk factors. Some of the risk factors for coronary artery disease include a family history of heart disease, obesity or being overweight, physical inactivity, an unhealthy diet full of processed foods that are high in fat, smoking, high blood pressure, diabetes, and excessive alcohol intake. It's also important to note that the risk of coronary artery disease is greater in males than females and increases with age.
So what is the genetic susceptibility portion of coronary artery disease risk? Coronary artery disease is heritable, meaning that it can be passed down from generation to generation. So therefore, if your grandfather had coronary artery disease, you could be more likely to have it. So some instances of fatal heritability are 57% for men and 38% for women, which is significant numbers. Certain genetic markers increase risk of developing coronary artery disease, including mutations in certain genes like the MEF2A gene, which leads to increased cases of coronary artery disease. Pictured is a cell that includes the MEF2A pathway, and as you can see, if there are defects, it causes thrombosis, inflammation, and EC proliferation. This is just one example. There are so many other gene mutations that can increase your risk of coronary artery disease through the genetic component.
Mediterranean diet and coronary artery disease. According to the American Family Physician Study, the total mortality rate decreased by 70% over 5 years in those who adopted the Mediterranean diet compared to the control. Why were these findings concluded? Because the Mediterranean diet is rich in monounsaturated fats, rich in omega-3 fatty acids, which are full of fruits, vegetables, and whole grains, and lacks saturated and trans fats.
So what are monounsaturated fats? It's a fatty acid with one unsaturated carbon double bond, and as you can see in the picture, the carbon-carbon double bond occurs within the hydrocarbon chain of a fatty acid. If there are more than one carbon-carbon double bonds, this makes it a polyunsaturated fat, and that produces different effects in the body. Some benefits of monounsaturated fats are that they reduce inflammation and lower your LDL, bad cholesterol, which reduces your risk of heart attack and stroke and reduces your risk of coronary artery disease. Some food sources of monounsaturated fats include olive oil, which is a really dominant component of the Mediterranean diet, along with avocado, almonds, hazelnuts, pecans, pumpkin seeds, and sesame seeds.
Benefits of fruits, vegetables, and whole grains. Fruits, vegetables, and whole grains contain vitamins and minerals important for overall health.
Fruits, vegetables, and whole grains are also high in fiber, and there are two types of fiber, insoluble and soluble fiber, but specifically, soluble fiber aids in the excretion of bile, because the fiber will bind to the bile and then it will be excreted. So, cholesterol synthesizes bile, so therefore, if soluble fiber is binding to the bile and it's getting excreted at higher rates, there will be more cholesterol that is needed to synthesize the bile, so therefore, cholesterol levels in the blood will decrease because it is being converted into bile. Lower cholesterol leads to a decreased coronary artery disease risk.
Saturated and trans fatty acids. First up, saturated fats. In saturated fats, there are no carbon double bonds. Saturated fats raise LDL cholesterol, increase inflammation, and some prevalent foods where saturated fats can be found are in cheese, butter, and bacon.
Then we have trans fats, which is by far the worst type of fat you can eat. It's a man-made addition of hydrogen to fats to increase stability and increase shelf life. It raises your LDL cholesterol while lowering your HDL cholesterol levels. The HDL cholesterol is the good cholesterol that you really want in your body because what it does is removes the bad cholesterol from your blood and therefore removes the bad cholesterol from your arteries and reduces the inflammation. It is prevalent in vegetable shortening, fries, and donuts. The Mediterranean diet is significant because it lacks saturated and trans fats, so therefore you're not getting as much of the negative effects of these two as you would in a traditional Western diet that includes a lot of saturated and trans fats.
Summary. In summary, there's a strong correlation between the Mediterranean diet and decreased instances of coronary artery disease. Monounsaturated fats and soluble fiber lower LDL, the bad cholesterol, in turn decreasing the risk of coronary artery disease, present in high amounts in Mediterranean diet.
Some recommendations that we have is to stray away from the typical Western diet, which is high in processed fatty foods. These types of foods are the ones that would contain the saturated and trans fats, which, as seen before, increase your LDL cholesterol levels, which is really bad for plaque formation. You should also focus on a whole food, plant-based diet rich in monounsaturated fats and fiber, much like the Mediterranean diet, and incorporate things like olive oil to satisfy your monounsaturated fat daily needs. You should have a diverse diet to capture a wide array of vitamins and minerals. As seen in the picture on the left, there's a wide array of colors, and when you eat a diet that's full of different colors, you'll likely get a sufficient amount of vitamins and minerals. We also recommend that you live an active lifestyle because being sedentary increases your risk of coronary artery disease, and exercise has a lot of benefits on the body. Lastly, we recommend that you avoid smoking and excessive drinking because these two things can also increase your LDL cholesterol levels and increase instances of coronary artery disease risk.
Here is a fantastic look at the people who made this incredible video possible. Stephanie here is a junior biochem and nutrition double major. Wow. And I myself am a junior food science major. Here are the references we used. And most importantly, thanks for watching.